Well, I've come up to Nose Hospital to the Minister for Health, Kate Beecroft. You're in the news all over the place, but the ones you've got for you, and we might get to other stuff, but the press releases, I mean, quite serious stuff here about going to consultation about prescriptions, but also the charter that you've come up with. So I mean, to put some meat on the bones, you want a 5-year charter, you want ideas from the public of what you should be or should not be doing. Is that a rough remit of how you see it?
Yeah, so it's going out to consultation, but the charter is really setting the parameters about what they can expect from us and equally what we can expect from them. You know, what I think there's got to be respect both ways. It's like anything, isn't it, really? It's just common sense, most of it.
I mean, moving to bringing the other thing in about putting up the price of prescriptions, that sort of thing. This is obviously was going to happen at some point. It must be quite galling for you to have to do it, because I mean, of all people, you know, your background would always be the one that would be protesting against this sort of thing, and now you are the minister. Has that been tricky for you?
No, I don't think I protested about increases where they were sensible. And when you think that it was $3.85, we're asking to put it up to £5. There's been no increase since 2010. And when you look at what's the UK one, £8, something like that.
Okay, well, why not just follow the UK? Isn't it easier for you if, like, the VAT is controlled elsewhere? It's just an easier option to say, well, we'll just mirror the UK's level rather than.
Are you saying we should have put them up by £5?
I'm trying to say to you, is this not tricky? Because this very thing is, it affects what 90% of people are getting free stuff at the minute.
Yeah, that's not sustainable.
No,
I mean, it isn't. We've got budgetary problems, but this isn't about the budget. It's because we've got budgetary problems, there's no new money. And there's things that we want to do to improve services. I've always, as you know, top of my list has always been the 24/7 thrombolysis service. Now there's no money for that. So this is a way of funding the improvement in that service, because it's clearly unacceptable to have something that runs from 9 to 5, Monday to Friday, for somebody who's had a stroke. That's just wrong. We have to find the money, and as somebody who's sort of in the older bracket myself, I think I would prefer to pay a little bit more for my prescription and have a 24/7 thrombolysis service.
Well, you're going to have another big overspend again this year anyway, aren't you?
We're doing our best to come in on target. We're doing our best.
And what about those targets? How are they looking these days? The ones that are now being published. Are we okay? Are you getting better? You happy? Well, the waiting list.
No, I can't be happy after 6 months. I mean, you've got to give us a chance to get there. But I mean, some of them are doing really well, like the cancer waiting times. That was, I think it was either 36 or 38% a year ago of hitting the 2-week target. Now we're in the 90s.
Okay.
In the 90s. I mean, that is a huge difference. And it hasn't cost any more money to do that, I must add. That's just by reconfiguring things to make the best use of how we do things.
Is this like the Ramsey thing then? Bringing people
exactly, yeah.
Are you relaxed about that now?
Absolutely. I mean, it was the right thing to do.
Back to obviously the thing that it's means testing, I suppose. Is that the way to describe this? That people who couldn't afford to pay up until they were pensioners, they would have got it free. Now they have to wait till 75. Is that roughly what you're saying?
That's right, which is in line with the TV licensing and things that government are doing to start with. The means testing thing is a bigger issue that's being looked at by a committee, and we want to come up with a set of rules for mean testing that goes across everything. Or certainly certain different categories. So there could be a couple of different definitions, but within strict categories, rather than me saying this is what we're doing and we're going to charge. There'll be a structure there that will encompass everything. And but that isn't here yet. So we've got to do things as we come across them now. I
mean, about this 90% of people get things free. That's quite staggering, isn't it?
It is.
Is that once you've been diagnosed with something, you just can then sign up and get it? I mean, I've always paid. I think I've always paid anyway for medicine. But it just seems like that's such a jump. I mean.
Well, no, it's not a jump, because if you're getting medication regularly, you can go for the prepaid certificate.
The £60 thing?
Yeah, £60 a year.
So how does that work? Anyone can do it. If once you're on a tablet, you say, I'll pay up front £60.
Anybody can do it.
Yeah.
You don't have to be on long-term medication or anything. You can have a prepaid certificate so that you don't have to pay any more whenever you get a prescription. So you either pay £5 per item, or for £5 a month, you can have as much as your doctor prescribes you.
An insurance policy, basically.
Yeah, it is. It's a very good scheme.
How are things going in health? Seriously, I mean,
well, it's a challenge, but I have to say it's one that I absolutely love. I love the department. I love the work in it. Yeah, there's some days that you think, oh dear, this isn't going so good, but then it always recovers and we get back on track.
And while I've got you here, then let's talk about that business when A&E was overstretched. That email went out, saying people shouldn't go up there. Did you regret the way that was worded, or was it an actual fact that we shouldn't go up to it? I mean,
no, really, it's down to common sense. If you've got, I mean, that was the most terribly serious road accident there's been. My understanding, it was the worst in about 20 years.
Yeah, but two were dead at the scene, I think, so there was only two that were presumably were needing treatment.
You've got to see to the others as well. I mean, you can't just say you're dead, leave them on the side of the road, for goodness sake.
I wasn't saying that, but if they can't have any medical help if they're dead.
They've still got to be seen to.
Right.
And the ones who weren't dead at the scene, they needed a whole team each to look after them.
Yeah.
Now, that is obviously going to have an effect on waiting times. If you go to A&E, nobody was turned away. If they turned up, everybody was seen to.
I think it was just a shock. The way it was worded was maybe wrong.
We were saying to people, go to your GP, go to your pharmacist, or go up to Ramsey to the minor injuries unit if it's something minor, because otherwise you're going to wait a long time.
Yeah.
And that's what it was about.
And the other thing, how are you getting on with your CEO? I mean, these days, is that all buried? The hatchet's been, you okay?
Hatchet's been gone a long time.
Yeah.
If there was one.
Okay.
I never saw a hatchet.
But this business in Tynwald this week about not releasing information from that freedom of information about the letter and all that sort of thing. I mean.
No, that's out of order. Yeah.
Right. Okay, so let's go back to the charter to finish with. People's responses are required.
Yeah, we want to hear what people got to say about it.
People are going to say they don't want to pay. I mean, presumably, I'm guessing most people...
On the prescription?
Yeah, they'd probably rather continue. But other things, I mean, what else
do you want?
Actually,
no. Some people are saying we haven't gone far enough. So you've got the absolute polar opposites. You've got people who are going to say, you shouldn't have touched this at all, you shouldn't be charging us, you shouldn't be increasing the charges in any way. And you've got other people who are saying, for goodness sake, you haven't gone far enough, like you did, say, why don't we just mirror the UK? And I'm saying we can't do that, because to go from £3.85 to £8.60 would be wrong, it's too much of a jump. Mm-hmm. So you're going to have the polar extremes. And I suppose really, if everybody's criticising us and saying they're not happy with it, probably means we're somewhere in the middle and have got it about right.
Are you happy with the job? Do you want to keep the job?
Absolutely.
Are you expecting to keep the job?
Yeah, absolutely. Why wouldn't I?
I don't know, I'm just asking you the question. I mean, that's what I'm here for.
I absolutely want to keep it. I love it. I'm expecting to keep it because I hope I'm doing a reasonable job here. Yeah, I'm looking forward to the future.